Hi, everybody. Tuning in on, this is day 4, so our last day, and EULAR has now officially closed down. It is Saturday, and my last session that I did was on pain. And again, very much of interest of all patients and myself as well. So it was broken down into 4 pieces, and the first section, the title of her session was How to Live with Chronic Pain, a Patient's Perspective. And it is, the person that delivered the speech was Nadia Malio. And she is the president of Pain Alliance Europe. She is a PhD student and psychologist. So she's got her hands in everything, and she did an amazing job of getting her point across. So one of the first points that she made was understanding chronic pain. She's well informed, and she just hit a lot of highlights. So understanding chronic pain. So the difference between acute pain and chronic pain. So acute pain is at least 3 months, and crossing over to chronic pain is when it is much longer than that. The common symptoms are ones we're familiar with: persistent pain, fatigue, stiffness, sleep disturbances, mood changes, decreased mobility, sensitivity to touch, appetite changes, cognitive difficulties, which I'm having right now, and social withdrawal. So bear with if I'm like flubbing up words. It's just happening now because we're all tired and kind of a little mind boggled. She talked about the types. She briefly touched on certain things because the other speakers dove into these topics a little bit more. But the types of chronic pain was chronic primary pain, which it recurs for longer than 3 months, associated with emotional distress and functional disability. Chronic secondary pain. Its symptoms arise from an underlying disease, such as chronic cancer pain, chronic musculoskeletal pain, OA, RA, and nociplastic pain. It arises from altered nociceptive, let me summarize this. For example, fibromyalgia and chronic widespread pain and IBS. Those are the type of nociplastic pain that fall into this category. We have chronic neuropathic pain, which is it's due to a disease, lesion, injury. Again, sorry about the words. Examples: sciatica pain and spinal cord injury. So sciatica pain, I have had experience with that. It's lower back pain, but it literally makes your legs, it makes it so painful to walk. And I ended up going to the emergency room for that one, and luckily got not at the emergency room, but scheduled a injection in my lower spine, which has held it at bay for a couple years now. So I am ever most grateful for that injection. But again, everybody is different. Coping strategies. She touched on physical therapy and just, pacing yourself, just kind of taking an extra thought of just, do I really need to do that, or let's get it done now and not delay it till later. Psychosocial support. So there is the cognitive behavior therapy, there's mindfulness, peer support groups, and mentoring people through those things. There's also adaptive tools and the use of technology. So there's a lot of those things that are available for everybody. The role of healthcare professionals. Now, something that she was focusing on is just truly offering some empathy and respect. it's really hard. And getting access to pain specialists. Not every rheumatologist specializes in pain, and pain is like the next level of something that you just need to know and specialize in it. So that's why a pain specialist is always a good idea when you're really, really struggling. And also the inclusion of care planning and, additional research. There's a lot of shared decision making that can happen, and there's a whole process to it. So learning about some of those things. Her key takeaways is chronic pain is complex and multifaceted. I couldn't say it any better. It is very complicated, and every single patient is different. It significantly affects the quality of life. Stigma, as far as how you're perceived, is always a barrier. There's integrative as well as personalized care. Personalized is a theme that has been repeating itself over and over and over as we've been going. And support for the healthcare professionals matters. Technology and self-care and mental health well-being is crucial. There was, the second session was about how can we prevent the transition from acute pain to chronic pain. And the person that presented was a integrative doctor and specialized in those type of therapies. She had all of us practicing mindfulness for 2 minutes before she even jumped in, just to get some awareness of what's going on around you. 67% of all health professionals are due to pain visits. So it's complex. Chronic pain is everywhere. There's no prevention. There's high costs. Frustrates providers, comorbidities, drug overuse, or adverse effects that can happen. Fragmented care, so not getting that next specialist that you need to see. Confusing diagnosis, not truly knowing or understanding what's going on in your body. Loss of productivity. That, again, there's days where I get nothing done. She had a couple resources that she offered. There is the U.S. Academy of Medicine report on relieving pain. So this actually was specific to guiding, coaching, and assisting patients with their day-to-day self-care for themselves and reducing those risk factors. They found that this type of coaching can prevent chronic pain and substance misuse, better long-term outcomes, higher patient satisfaction, and reducing cost of care. All things important to us. Both risk factors and protective factors impact the slippery slope of pain progression. So there's strengthen protective factors and reduce risk factors. Those are all very important parts of our everyday life that we should focus on. Reducing the risk factors would be trying to work on your poor sleep quality, working on your diet, your stress, repeated strain, inactivity, just not being a couch potato just because it's easier to do than getting up and doing some exercise. Walking is an amazing thing that everybody can do. Unfortunately, self-care training that addresses the whole person is often neglected in routine medical care, and I can definitely see that. Pain prevention program for transformative care, the 4 T's. The 4 T's include treatment, training, and pain protection education, telehealth coaching, which is easier than going into the doctor's office, and technology. So using those different platforms and AI-driven risk reduction training and health coaching can all be done in a significant manner. So she had a lot to share. The next piece is on pharmacological treatment of chronic musculoskeletal pain. It definitely was quite eye-opening, and he hit several different facets. Musculoskeletal pain, prevalent problem, obviously. Why is musculoskeletal pain so complicated? The next one, the pharmacological pain therapy, the pros and cons, and there was a couple things that he did mention that, not every patient's going to follow every guideline, and I'll get to that in a second. He talked about with having a rheumatic disease that there is a biological clock, and it's accelerated in people that have musculoskeletal diseases. And so for patients, it usually leads to severe chronic pain, but that biological clock ticks faster in us, unfortunately. Why is the pain severity of RMDs underestimated? Because pain often is invisible, as we all know, using traditional medical imaging and different blood tests that are done. People with lived experience of pain may be stigmatized because the healthcare provider cannot determine the cause of pain. They don't know why, and hence they can't understand the intensity of the pain. So everybody's pain's different. You can never judge somebody by that. There is, they said sensitization. So different diseases that have increased sensitization and increased pain, which can be OA, RA, there was whiplash, there is tendonitis, things like that, that you topically, it's different pain sensitive. And let's see. Another point that I found very interesting is the multidimensional pain. So there was those different kinds of pain, nociplastic, nociceptive, and neuropathic. And this doctor was definitely saying that it's mixed pain. It's not just one kind of pain. At different points in your life, or even in the same day, you might feel different kinds of pain, and it can't just be pinned on one thing. So important factor. Let's see. Pharmacological pain management. This is a slide I'll throw in there. I think it might be of interest to some patients. It offers what is out there currently for musculoskeletal pains, for joints and soft tissue chronic pain. So all the different levels there. Look for the attached slide when for this piece of that I'm doing now. They did bring up cannabinoids. Cannabis, that's what we're talking about. Their position at this point is saying that studies are generally of poor quality that exist right now, and they say that TCH and CBD cannot be recommended for managing chronic musculoskeletal pain. And there's a lot of people that disagree with that, and they feel almost immediate relief in certain ways. So again, we all have different feelings on things. There are also another list, this is another slide I'll share, which are possible new treatments for pain. And there's a whole list of them. A lot of them are very scientific, and I think it's looking at a particular receptor point. So take a look at some of these things. And there was also, and what jumped out at me was a nicotine receptor antagonist. So I found that kind of interesting as well. Let's see. He basically summarized all the things that I was just saying. I kind of went into a little bit more depth just to give you an idea, but he definitely, the biggest focus he said was the mixed pain. Then the last piece was on non-pharmacological type treatments. And he was from Denmark. There was a slide, and I might include this one too, because this one's a really good one, kind of showing where the pain burden is. Talks about chronic pain burden. Talks about 20% of adults live with chronic pain, and 50% with severe depression symptoms as well. 33% with high impact chronic pain, and other peripheral that are not even identified at this point. So sometimes the non-pharmacological treatments may be a little bit better choice for you. Things that he kind of focused on was exercise therapy, cognitive behavior therapy, which I talked about in the last one, patient education, lifestyle changes, kind of dealing with some of those risk factors, multidisciplinary approaches, so combining the physical, psychological, and lifestyles all together. So a whole person looked at, not just my finger, for instance. Different kinds of exercise therapy have been found to reduce pain and improve function. Acupuncture has been found to reduce pain and improves function. The multidisciplinary therapy reduces pain and improves function. Wow, this is pretty. And psychological therapies, they say, have definitely been found to reduce pain. So that's always good to know about. There were some non-invasive brain stimulation for pain therapies. So non-invasive is always a good thing to start with. There was also a repetitive TMS stimulation. So again, it's dealing with your vagus nerve. Am I saying that right?
Yes.
Thank you. And this stimulation is supposed to improve pain in fibromyalgia. So I know we don't cover that, but some of us have those comorbidities. So I thought it might be of interest to learn about. So that is the end of that. I know that was a little bit longer, guys, but again, things that we always want to learn more about and hear more about. And you can also learn more about the latest and greatest information that's out there for non-invasive therapies as well that are not pharmaceutical. So